Researchers at the University of Calgary AHS Libin Cardiovascular Institute of Alberta are hoping to save lives by broadening the guidelines used to determine which patients would most benefit by receiving an implantable cardioverter defibrillator, or ICD.
The ICD is a small computer monitor that has mostly battery and wires connect to it, and the purpose of the machine is to detect abnormal heart rhythms and to treat them. We're treating a problem called sudden cardiac death. And sudden cardiac death is pretty common. Of all the people who die from heart disease, about half of them will die from sudden cardiac death. So that's about 50,000 people every year in Canada. And the way these machines work is they're implanted like a pacemaker, typically in the shoulder area. And the wires are then connected from the heart to the device, and the device automatically will pick up a fast heart rhythm. And if it doesn't go away in a few seconds, will actually deliver rapid pacing or a shock to reset the heart. Basically, it's like having a paramedic under your skin there 24 hours a day. We put in about 500, 600 of these a year in Alberta. And right now we put them in people who have very poor heart function, because as the heart weakens, people are much more likely to have sudden cardiac death. But the challenge is there's a huge number of people with heart disease, and trying to find that person who will have sudden death versus the rest of the people is very difficult. It's like trying to find a needle in a haystack. So Refine ICD is a study that was started with an earlier study where we did the heart monitors and found that a couple of signals predicted people who were at higher risk of having sudden cardiac death after a heart attack. And the way we do that is through something called a randomized trial. So a randomized trial is where you select the people for the study, and half of them get one therapy, in this case a defibrillator, and the other half they would get standard care. And we then follow those people over a number of years, an average of about 5 or 6 years, and we'll see whether in fact we can save lives with implantable defibrillators. So this kind of study takes many, many years. So the initial study that we did, where we actually found the signals that predict risk, took about 8 years. This next phase, which started back in 2010, will take probably another 8 to 10 years. So we don't expect to actually have the results of this done until sometime around 2018. So with a lot of these projects, from when we start the study until you have a definitive answer is close to 2 decades.